Hello to everyone who has found me here at my website. My name is LaWanda. I'm a registered nurse. I'm an ex-employee of Menifee Valley Medical Center, and this is my blog. So I wanted to have a space where I could tell people, share my story with people so that I can shed some light on the situation that has just occurred at Valley Health Systems, who is now PHH. I want to make this disclaimer so that it is clear to anyone who visits my site. This is my site. It is not endorsed by anyone, and everything that is on this site is based on my account of my experience as a Menifee Valley Medical Center employee. So once again, I want to say hello to everyone and thank you for being here. On October 12, 2010, at approximately 7 o'clock in the morning, I received a call from my manager, Jan, who is the manager of the ICU and the ER, and I was told at 7 o'clock in the morning that I was not being transitioned over by PHH and that I no longer had a job. PHH stands for Physicians for Healthy Hospitals. They have now purchased what used to be Valley Health System, which consists of Hemet Valley Medical Center and Menifee Valley Medical Center. So I, along with so many other people, on Monday at 7 o'clock in the morning, received notification that we were not being transitioned over. So this is the starting point where I needed to start my blog and needed to start documenting my journey of what is going on in my experience with Menifee Valley Medical Center. So first of all, let me tell you, if you don't recognize me, if you're not one of my coworkers, if you're not a Valley Health System member, ex-Valley Health System employee, let me tell you who I am, because you may recognize me. I have been a registered nurse for 21 years. I have always worked in this community as far as Riverside, San Bernardino, in this general Inland Empire area. I have specialized in critical care, meaning ICU. I did some ER. I also did critical care transports where I rode in ambulances and transferred patients between facilities, interfacilities. I came to Menifee Valley Medical Center 2 years ago, almost 2 years ago, in December of 2008, and I applied for a position in the ICU, and I was readily hired, and I began working at Menifee Valley Medical Center. When I first began working there, I was very impressed by the camaraderie amongst the employees in the unit where I worked, specifically on the night shift. I thought we really, they welcomed me in, and we really worked well together. We were able to have conversations together, and everything sort of clicked really right off the bat for myself and my other night shift employees. And to me, I could really say that that was one of the benefits of working there, was the people. In fact, that is the only benefit, in my opinion, while I was working there, was the people. I had been there less than 30 days before I met my union rep, and I had never been in a union before. This is my first experience with a union. However, as I was talking to this person, I guess it became painfully obvious to him as well as to me, is that I was someone who was going to be a quote-unquote activist. And I say that because at the time when I had the conversations with him, I was making so many suggestions out of how we could improve our working conditions and how we could improve the morale of the nurses, because stepping back to let you know, if you hadn't been aware of what was going on with Valley Health Systems had been in a bankruptcy situation for years. Basically, I can tell you from my opinion that the nurses and the staff were completely beat down after going through so many changes with Valley Health Systems. And if I can, I will try to put a link in this blog to the press enterprise, who have sort of outlined a timeline over the last 3 years of what the system has gone through, and there had to be, measures put on the ballot trying to get funds to keep that system afloat. And then, of course, there was a lot of controversy about certain physicians who were in leadership, and there's just been tons and tons of controversy going on with this hospital system for apparently at least 3 years. And the staff, to me, in my opinion, coming in fresh, almost looked to be in sort of a post-traumatic stress type situation, because they were very apathetic. They had almost all their benefits taken away from them, even though they had a union contract. But because of the bankruptcy, they had almost all their benefits taken away. They really didn't have, and let me just speak to myself. I noticed that we did not have the things that we needed to take care of patients, and so this is why, just in my nature, I began to speak and to speak up and to speak out and to be the voice of the people in the unit that I was working in. So naturally, in fact, I was so energetic, and I was so happy to be able to give my feedback, and to be able, because my whole goal was I would really like to help lift the morale of my coworkers, and I would also like to improve the environment of care and the quality of care that we give to our patients. And I felt personally that I could do that by becoming an active member in my union, and so that's how I became a union steward. So I decided to make this blog because, as I say, I wanted to sort of start to document this journey, because I don't know how far it will go. As of now, I am an unemployed ICU nurse who has had 21 years of experience, and I'm going to post in the blog that I put this audio post in, my resume, and I find that important to put here, because what people see and hear from me on this site, they will need to know that I am not coming out of left field, and I am not coming from a position of not knowing what I am speaking about. And you will see that I have had a progressive rise up through management to middle management, and so I've done quite a few things in my career that put me in a position to be able to identify some things that can be improved, and some processes that needed to be put in place, and systems that needed to be put in place in order to be able to provide certain standards of care to patients. And that, to me, was my ultimate goal. However, what apparently has happened, because I can tell you that it is my feeling that the only reason why I was let go is because I became the most vocal steward in our entire hospital. And I wound up not only representing, my unit, I wound up actually being the person that people from all parts of the hospital would come to with their issues. And so I was definitely walking around with a target on my back, I'm sure, as far as management was concerned. I have never been disciplined for anything in my entire career, but let's not go there. I have never been disciplined for anything at Menifee Valley Medical Center. I have never had any run-ins with any disciplinary actions. I am not the new kid on the block. There is no identifiable factor that you could find out why I would be let go. There is no rhyme, and there is no reason. And in fact, to the 30 to 40 people that were let go, you may not think that there is really a rhyme, a reason, or a consistent thread amongst the 40. But I can tell you this, and this is a guesstimate. I believe about 60% of the leadership was let go from Menifee. And when I say leadership, I mean union stewards and bargaining team members. Okay, so it was fairly obvious that we were being weeded out, and I think that's fairly obvious, and I'm only saying from my end because I obviously don't speak for PHH. But when you look at who got let go and where, you can sort of, come to some decisions of your own. I'm not here blogging trying to specifically insinuate or imply anything regarding PHH. I actually don't have any clue of who PHH is and how they found out who I am and why they picked me out of my unit to be let go. Well, sometimes you can add up 2 + 2 and you don't need to see the whole story, because as I say, I have never been disciplined for anything in my entire career, much less at Menifee. I bet if my coworkers were not at this point completely feeling scared to say anything, because I have actually spoken to my coworkers since I got let go, and their exact words to me are, if they can let you go, we don't have a chance. If we say anything, they're going to get rid of us. And that is exactly what the plan was, in my opinion, to be able to lift that leadership out of those hospitals, both Menifee and Hemet, to send the message that, okay, we don't really want your union here, we don't really want you organized. But I'm jumping way ahead of the story because I do want to get back to Monday and how we got let go. 30 to 40 people got let go from between Hemet and Menifee. And I think it's important to know that almost all of us were people in good standing. We had people who had been there for 33 years who were let go. If a person's been there for 33 years, never had any problems, why would they be let go? Okay, and so I needed to put this, I felt compelled, and right now you don't know, but it's like 2 o'clock in the morning. I felt compelled to put this up and to put this out, because I want for anyone who can see this website between now and tomorrow night to know that we are having a vigil out in front of Hemet Hospital between 7 p.m. and 10 p.m. to show the community and to start to get the community involved and letting you know that you have just lost hundreds and hundreds of years of experience in these 2 hospitals. And probably you all out there know as well as I do that what the quality of care was in that hospital, in those hospitals, and you can sort of guesstimate what the quality of care may be like after losing 40 some odd professionals. This is just my opinion. So I wanted to let you know there will be a vigil from 7 p.m. to 10 p.m. tomorrow night, Thursday, at Hemet, and then also from 7 p.m. to 10 p.m. at Menifee. Please come out and support us. I want to get the community involved. This is about the community who is losing qualified healthcare professionals who have lived and worked in this valley for all of their career. Some of them have just now been found out that they do not have a job. So I'm going to make several blog posts. I'm going to keep them to 15 minutes or under. This is my first post. I wanted you guys to see who I am and to know that if you're interested in following what's going on on the ground and really on the inside of this whole transition, this is where you're going to be able to get that type of information. So, I hope you stay tuned, and I hope that somehow this measure of me starting this blog will somehow help 40 people get back to work and help our community have a safer hospital to go to and a safer ER at Hemet to go to. So I'm going to be giving you some information here and doing the blow by blow as things unfold. So I thank you so much for being here, and I thank you so much for supporting me and my coworkers and our community, and I hope that we can get our jobs back and we can get back to work taking care of our patients.